Hi guys, let's see about human immunodeficiency virus today. It has positive single-stranded RNA belonging to Retroviridae family. In Retroviridae, we have Delta virus and lentivirus. HIV belongs to lentivirus and we have HIV1 and 2 serotypes. It has structural genes and non-structural genes. The structural genes, we have three important structural genes. One is the envelope gene, which codes for GP120, which forms the spike protein on the envelope, and GP41, which is the transmembranous part of the protein, and Paul gene, which codes for reverse transcriptase, integrase, and protease enzymes. We have GAG gene, which codes for protein 17, which forms the matrix protein, and P24, which forms the core protein. P24 is widely used for diagnosis of HIV infection. In the viral replication, we have the provirus, and the fourth step, it is the proliferation and release of the virion. The viral copies are made and then the protein particles are made, and both is combined together and released with the help of protease enzyme. So we have various drugs which helps on various levels. In the first drug, we have CD4 receptor inhibitor, that is ibalizumab, and then in the second step we have co-receptor blocker, that is maraviroc receptor, and fusion inhibitors like enfuvirtide. And in the reverse transcriptase blockers are of three types. First one is nucleoside reverse transcriptase inhibitors like abacavir and lamivudine. And we also have emtricitabine, nucleotide reverse transcriptase inhibitor like tenofovir disoprostatil. And then we have non-nucleoside reverse transcriptase like nevirapine and efavirenz. Integrase blockers like dolutegravir have two mutations. Some people in the population have delta 32 mutation. They have a defective CCR5 receptor on the macrophage. Hence, they show some resistance to AIDS infection. And DC sign here, the dendritic cells have a C-type lectin receptor which binds to HIV. They have more chances of more severe disease. Modes of transmission is sexual, more than vertical, more than intravenous route, more than blood transfusion, more than needle stick. Progression of the natural diseases following infection, there is an incubation period of 3 to 6 weeks, which is followed by an acute retroviral syndrome, and which is followed by a subclinical replication stage, which is called as the clinical latency. Remember, it is not microbiologically latent. Then the patient will have persistent generalized lymphadenopathy. Then they have symptomatic HIV infection and AIDS, which about we will see in the next video. And the investigation now we are doing is fourth generation combined antigen antibody assay, which is a type of ELISA test, and the treatment is TLD regimen. Thank you.